Good afternoon, everyone, and welcome. My name's Dr. Felice Watt, and I lead the Women's Mental Health team here at Sidra. Today, we are going to be commemorating World Maternal Mental Health Day. Dr. Sawssan Ahmed, who I will introduce a little bit later, will be talking with us about mental health during the COVID-19 pandemic, and also about anxiety and some tips and strategies to manage that, because certainly it's increased at this time. The webinar is going to be recorded, and it would be very helpful if you could continue to have your microphones on mute. There will be time for questions at the end, and what I'd like you to do is to post your questions in the Q&A meeting chat, and we'll monitor the questions and then address them at the end of the presentation. Okay, before Dr. Ahmed presents, I'd like to share with you a little bit about why we commemorate World Maternal Mental Health Day. Next slide, please. So, World Maternal Mental Health Day is actually celebrated around the world, and the aim is that it will draw attention to the essential mental health needs for mothers and families. We know that pregnancy and after having baby is a vulnerable time for women, and that it's a time where there can be increased mental health difficulties, but treatment is available and effective. So we want to draw attention worldwide to the awareness of this and help to reduce stigma surrounding mental health difficulties. This year's theme is Let's Invest, call for action for investment in maternal mental health, and I'll talk about that later. I'd now like to introduce our speaker today, Dr. Sawssan Ahmed. Dr. Ahmed is a clinical psychologist in the Women's Mental Health Clinic. She came to Sidra in 2017 from the Los Angeles area in the US. As part of the Women's Mental Health team, she provides treatment for women who are pregnant or have given birth to a baby. Dr. Ahmed is fluent in both English and Arabic and provides treatment in both languages. She conducts research to better understand the social and cultural factors that influence the cause and treatment of mental illness. Currently, she's the principal investigator on a Sidra medicine program that is adapting mothers and babies, an evidence-based psychological intervention to be used with Arabic-speaking pregnant women. The interventions and treatment she provides is supported by clinical research and is tailored to suit the women's culture and family situation. Welcome, Dr. Ahmed.
Thank you, Dr. Felice. So good afternoon, everyone. Assalamu alaikum. Thank you for joining us today. As Dr. Felice mentioned, today we're going to be talking about anxiety and the COVID-19 pandemic and just sharing the impact on mothers and mothers-to-be and sharing some tips and resources to manage anxiety. Just an overview of what I'll be talking about today. COVID-19 and maternal mental health, how to manage anxiety. I will be giving some specific resources and tips. And then Dr. Felice will talk about this year's World Maternal Mental Health Day theme, which is investment in maternal mental health is an investment in the future. And at the end, we'll leave some time for questions and answers from the audience. Okay. So when we're thinking about COVID-19 and maternal mental health, there's some unique challenges that women face. Women who are pregnant or mothers-to-be or planning to become pregnant or trying to become pregnant. One of those challenges is social isolation. Loneliness due to social isolation from the COVID-19 pandemic and restrictions due to that, as pregnant women, as a new mom, as a mom of young children, feeling that there might be a lack of social support, not knowing where to take children to keep them entertained because of various restrictions, feeling alone because one cannot connect with family and friends, etc. There could also be for pregnant women, they may have some anxiety and worry about the disruption in their normal schedule of obstetric care. There may be some worry that they can't get to certain appointments or certain appointments are virtual versus in person, and that might be a source of anxiety and worry as well. Another challenge is facing expectations about delivery. Thinking about who will be there because of restrictions, maybe there only 1 or 2 people are allowed to be there and that in the delivery room, and that may feel like limited support, limited visitors, change in the regular way women and families are used to celebrating the arrival of a new baby, where you may be used to large celebrations with family and friends, and that is limited now due to the pandemic. If your family is not local, for example, if you're an expat, your family may not be able to come and travel to attend your delivery because of the various restrictions. And then, of course, there's worry about catching COVID as a pregnant woman or having a newborn and being worried about them and not having enough immunity if they were to catch COVID. And then there's also, of course, as vaccines are being disseminated, worrying about vaccines and the decision to whether or not to take the vaccine as a pregnant or nursing mother because of the limited research on vaccines and pregnant and nursing women. And then, of course, for women who are trying to conceive, because of the opening and closing of the various medical offices, sometimes their fertility cycles can be disrupted. You may have a plan to go through various fertility treatments, and that's now disrupted because of the pandemic. And then there's blurred boundaries with working from home and children attending school from home, virtual learning, where the school life is blurred, day and night schedule shift is blurred, and that can impact sleep. That can make one feel like they're always working because there's no separation between your work life and your home life. That can cause other challenges as well. And of course, we, as mothers or fathers or aunts and uncles and family members, worrying about the ripple effect on children. We know that, of course, the children are being affected by social isolation due to the pandemic and virtual learning. And we're just beginning to understand how that effect may be. I wanted to go a little bit over some of the research that's been recently published on the pandemic and how it's affecting mothers-to-be, and mothers of young children and children as well. So we know prior to the COVID pandemic, rates of postpartum depression across the world are around 14 to 20%. However, we're seeing a large increase in perinatal depression, reported psychological distress, anxiety, etc., in samples across the world and also locally in Qatar. For example, one study found with a mostly North American sample, 40.7% rates of perinatal anxiety and 72% of moderate anxiety. That is a lot larger than what we usually see in perinatal mental health. And in a local study in Qatar that was collected data during the height of the pandemic here in Qatar last June, July, rates of anxiety were 34.4% and 39.2% in women who are pregnant or 6 weeks postpartum. When the data that we currently have shows that these rates are usually around 19%. So there's a large increase there. And then there is, of course, impact on mothers. So one study, international study that looked at mothers who have children between the ages of 0 to 18 years old found that there was 35% of mothers who have children 18 months or younger reported clinical depression. Mothers with children between 18 months and 4 years, 42% of them reported depression. And mothers of children between 5 and 8 years, 30% reported clinical depression. And we see similar rates of anxiety as well. So that tells us 1/3 of mothers of young children are clinically depressed or clinically anxious. That's a very large number. And then we can look at the impact on children, of course. Various research has been published internationally, studies in Bangladesh, China, the US, Netherlands, and Peru, and all have shown high rates of depression and anxiety in children and adolescents. And studies show that those living under lockdown restrictions fared worse than children who are not. So there's definitely an impact on children. As we discussed before, there's that ripple effect. If your children are not feeling well, you as a mother or a father are not feeling well as well, and vice versa. So thinking about that as well. So now that we know a little bit about the situation in terms of mental health and mothers-to-be across the world due to the pandemic, let's talk about how to manage anxiety related to the pandemic and other concerns associated with the pandemic. The first thing I'd like to say, and I really want to emphasize this, and we've all seen this image when we fly, and we've heard of this as well when we fly, but put on your mask first. Before we can talk about managing anxiety, and the reason why we're talking about managing anxiety is because as mothers and mothers-to-be, we cannot take care of our children and our families without taking care of ourselves. And sometimes this is the last thing on our mind. We feel like we have to take care of everyone else before we can take care of ourselves, but it's actually the opposite is true. So if we're not feeling well, we can't take care of our children or our families. You're not good to anyone if you yourself are not well. So put on your mask first. A second general tip I would like to discuss, which if there's one thing you can take home today from this webinar, is self-compassion. Being a mother requires self-compassion. And so what do I mean by self-compassion? What does that mean? Self-compassion is having the same compassion towards yourself that you have towards others. The compassion you show your children, the compassion you show your friends and you show others, it is recognizing that everyone is human and imperfect. Nobody is perfect. And being kind and gentle to yourself. It's about taking that compassion you show to others and turning it in towards yourself. And that includes self-kindness, which is being gentle and merciful on yourself, forgiving yourself when you make a mistake or you're having a hard time, not being harshly self-critical. Example, we had a bad day, we said something not so nice to our husband, or we said something not so nice to our child. You feel bad and you can acknowledge that you did something wrong. You can apologize, but then move on. Don't sweat the small stuff. Have some compassion towards yourself. And then we can also talk about mindfulness, recognizing when we're feeling low, when our mood is down, or we're feeling overwhelmed without feeling guilty or self-judgmental or overreacting. That's part of self-compassion as well. So being attuned to our state and our internal state. And then we can talk about connectedness. Remember, we all make mistakes. COVID is hard for everyone. No one is having a good time. No, virtual learning sucks. I'm going to say it. It's not pleasant, and you're not alone. We're all going through this together, okay? And no one is living that perfect life you see on social media, that perfect mother, that perfect family. It's not real. So being attuned to that and knowing that you're connected through the human experience, and imperfection is part of that human experience, that's self-compassion. So accept the imperfection in yourself and use that as a tool as well. And then I just wanted to talk about some general wellness habits for mothers and mothers to be in, and everyone, to be honest. The first thing I wanted to talk about is taking care of the basics. The basics would be eating, good nutrition, exercise, movement, and of course, sleep, good sleep. So general wellness tips is making sure that this is a priority in your life. And what we know is, and I really want to emphasize sleep. Sleep is so important. Research shows that 50 to 80% of people who are receiving mental health services report sleep difficulties. So sleep is very much tied to your wellness and your well-being. The second thing I wanted to talk about was routines. So the COVID pandemic, working from home and virtual learning has kind of put, and I would say right now Ramadan as well, has kind of changed our routines or kind of disrupted our routines. So what we need to do is take that back and look at our routines and establish a time for work. When it's time for work, we work. When that time is over, we establish a time for leisure, time to spend time with our families, time for ourselves, and then sleep. So schedule work in. Once that time is over, move on and leave it, okay? And move on to the next part of your routine. And of course, scheduling time for sleep and rest is very important, okay? And then spirituality is a general wellness habit to have. Research worldwide and with different religions suggests individuals who are religious have better mental health to start with, and they're better able to cope with stressful life events. So being that is Ramadan, let's put an extra emphasis on this. Ramadan is a time to focus and reflect on spirituality, and incorporating mindful spiritual practice is very much part of Islam and other religions as well. And things like prayer, reading Quran, daily dhikr, these, novenas, these types of practices are all spiritual practices that are rooted also in mindfulness, that are wellness habits to incorporate into your life. And then I also wanted to talk about information consumption. Limiting time in exposure to negative news and social media about COVID is very important, especially before you sleep. And the thing is a lot of us, we use that time before we sleep to scroll through our phones. And that's when we see sensationalist news. That's when we see, scary things, and that disrupts our sleep as well. So just as you take care of what you eat, what you put in your body, take care of what you put in your mind, and limit the negativity that's being put in your mind. So limit and take care of what you see and what you read, okay? And then prioritization. These are difficult times. These are unusual times. This is not a normal time, okay? And so maybe everything on your to-do list doesn't need to get done right now. Maybe, and that's part of sort of self-compassion as well. Maybe the house doesn't need to be perfectly neat all the time. Maybe it's okay if your child didn't finish their homework that day, or they skipped French class. And I'm going to use that as a personal example. Maybe that's today is your child is tired, they can skip that class. Maybe it's about prioritization, okay? Maybe the family can eat leftovers for an extra day. So prioritizing and being gentle with yourself, okay? And then let's talk about connecting. We are social beings. Humans are social beings. A lot of us are missing physical connection, especially with our friends and family due to the pandemic. So finding ways to connect with others in safe ways, things like phone calls, spending time with your bubble, socially distanced walks, Zoom dates, etc., are all ways we can connect to others. And I want us to also think about some unique opportunities that the pandemic has presented in terms of connecting. I'll give you an example. This morning, not only did I have a presentation to give today, my son had his big final presentation for school today. And because of the pandemic, everything is virtual. And my brother and sister-in-law in the US were able to join in because of, they obviously weren't going to be able to fly here to see his presentation, but because of the pandemic, they were able to join in and listen. And me as a working mom, usually I have to miss these kinds of events at school because they're during the day, but because of the pandemic, I could join in as well. So thinking about what are the opportunities for connection that the pandemic is affording us is also something to think about. And then I wanted to also talk about something that I think is very important. I think in the modern world, we often put a lot of pressure for mothers and women to do everything themselves, to work, to go to school, to be present for our children and our families, and to do it all alone. But it's important to ask and accept help that's available. Okay, it does take a village. It's not, we weren't meant to raise our children and live in a bubble with no one else around us. Okay, so it's takes a village. This is a collective experience. So in terms of the pandemic, asking for help for those who are around you, your spouse, your family members, is really important as well, because you can't do it all on your own. And then in terms of just specific COVID-related anxiety, I wanted to talk a little bit about some tips that might be helpful as well. So first of all, and specifically for pregnant women or women who are recently delivered, you may have a lot of physical symptoms that you don't usually face. So you may be attuned to more of those physical symptoms because of the pandemic as well. And also you may have some anxiety related to the vaccine, and maybe, also be attuned to symptoms or bodily changes due to the vaccine. So some tips that can help manage that anxiety is just one, distracting yourself or keeping your mind busy, because the more you pay attention to physical symptoms and physical concerns, the more they might feel more intense. And we know that from research. So trying to just distract yourself and see if you still feel those symptoms later, okay? And then challenging your thoughts, okay? Think of alternative explanations for your symptoms. So once you feel like you are having some physical symptoms, is it really the vaccine? Is it really COVID? Or is it maybe that you didn't drink enough water that day and your throat is a little bit dry, but you're things like that. So challenging your thoughts. And then monitoring how often you are symptom checking. So postpone the worries about the symptoms that you're having, whether it's related to fear about having COVID or fear related to taking the vaccine, is seeing if your symptoms are intense when you're symptom checking. So monitoring how many times you're symptom checking and whether the symptoms are more intense when you're doing that. And then the number one tip we give our patients all the time is avoid, and I think as medical providers, healthcare providers, we tell our patients this all the time, avoid Dr. Google. Google is not your doctor. Okay, Google is not a doctor. Remember that when we use Google and other things to kind of diagnose ourselves, you're going to be looking for evidence that confirm your thoughts, okay? And that's called confirmation bias, is that when we have an idea in our head about what might be going on, we seek information to confirm that that's what's going on when it's not actually going on. So avoid Dr. Google, okay? And then, as I mentioned earlier, but avoiding sensationalist news about COVID, specifically COVID outbreaks, vaccine issues, instead of just Googling and looking for things that are, not from reputable sites, look for reputable sites and use those as ways to get information about the pandemic and vaccine when you need to, and definitely not before you sleep. Okay. And then finding ways to calm down and relax your fight or flight response. We'll be talking about deep breathing as one way to do that in the next slides. And then I wanted to make a mention about re-entering your normal life or life before restrictions at your own pace. Some people may actually find it difficult as things open and might find that as a source of anxiety as well. So create your own boundaries, and you shouldn't feel pressure to not follow the restrictions or to enter normal society at a fast pace. Do what you're comfortable with. Okay, and this is especially the case for people who have social anxiety or prior social anxiety, or the pandemic may have exacerbated and that vulnerability to social anxiety as well. Okay. And now I wanted to talk a little bit about some specific tools you can start incorporating in your life that you might think might be helpful for you. And I want you to think about these tools as something you carry around with you and that you can utilize regularly, and also when you're facing some specific difficulty, okay? And you might find it helpful to screenshot some of these tools and resources that I present. So I'll pause so that while I'm speaking so that you can have the opportunity to do so. Okay. First, let's talk about mindfulness and relaxation as a tool. So when we talk about mindfulness, we talk about being in the present. So being in the present with what you're doing at that very moment, okay? This is the opposite of multitasking. It's about when I'm walking, I focus on walking. I focus on what I'm seeing when I'm walking, what I'm hearing when I'm walking, etc., okay? And it includes also an awareness of our thoughts, which are going to be a helpful tool to use when we talk about thoughts and the impact on thoughts on our mood. So I want you to keep that in mind. Part of mindfulness is being awareness of our thought, having an awareness of our thoughts. And mindfulness can take on many forms, including things like yoga, mindful walking, spirituality as well is a mindful task as well. And mindfulness is helpful because it helps you manage and regulate your emotions. Having a more mindful stance on life allows you to, when you're faced with various difficulties, it allows you to regulate your emotions and not react in a way that might be harmful to you. And mindfulness takes practice. So when we talk about some of the tools for mindfulness, I want you to recognize that it's not something that's easy to it's not our usual way. It takes practice. So give yourself time to practice and try to develop these tools and these practices in your daily life. Okay. We'll be talking about deep breathing and slow breathing in the next slide, but there are other mindfulness and relaxation strategies that I can't talk about because of the limited time today, but if you would like to look into it, things like visualization and progressive muscle relaxation are also helpful relaxation strategies and techniques you can use. Okay. So now let's talk a little bit about slow breathing. I'm going to tell you about the technique. It's a mindful relaxation technique, okay? There's different kinds of slow breathing techniques, and then we're actually all going to practice together, okay? The first rule of slow breathing or calming breathing, this relaxation technique, is making sure you're sitting either in a comfortable chair or laying in your bed. Taking a breath in, this is one way, through your nose if possible for 4 seconds. And letting your abdomen expand fully while you're doing so. And then holding that breath for 2 seconds. And then releasing or exhaling that breath for 6 seconds through your nose or mouth, whatever is more comfortable to you. Okay? Pausing slightly and then starting again. Okay? I usually recommend to patients to do this 2 or 3 minutes at a time when they're first developing the practice, and then they can go up to 5 minutes if they'd like. It actually doesn't take a lot of time. Some of these tools that we're talking about today are not meant to be things that take a long time that you won't be able to do. And as I mentioned earlier, this is a mindfulness strategy, so it's practice is very important to kind of get a hang of it, and so you can incorporate it in your life. I recommend trying to do this at least once a day, or preferably 2 times a day, even when you're not feeling stressed or you're not feeling anxious or you're not feeling low, as a way of prevention and emotional regulation. Okay, doing so, it's going to kind of put you at a set point that's already at a calmer level than you might usually be. So that, again, when something happens, you get frustrated that day because of the house is messy, the kids are acting up, you are very nauseous because you're pregnant, or you're feeling very heavy because of pregnancy. This is kind of already starts you at a lower level, at a calmer level than you would normally be. So I would recommend doing it at least once, preferably twice a day, and then using it when you feel dysregulated as well, when you're feeling frustrated, when you're feeling overwhelmed, using this. And again, we're not talking about spending half an hour, 20 minutes. It's really 2 to 3 minutes is a good amount of time. Up to 5 minutes is a good amount of time. Okay. Now I want everyone to practice with me as you're seeing the GIF here, okay? As the circle gets bigger, I want you to inhale, and then we're going to pause for a second or two, and then we're going to exhale, okay? And this one is a little bit different in terms of the amount of seconds, but it's also a useful one to use, okay? And I'm gonna ask Dr. Felice to do it as well, and I'm gonna do it as well. We're gonna practice 2 rounds. But again, if you're doing this at home and trying to develop this as a strategy, spend more time than that, okay? So I'll wait till the GIF goes down so I can start with inhaling, okay? So inhale, hold, exhale, hold, exhale, inhale, okay. So I hope you got a little bit of a feel of how that might work, and you can try it at home as well. And just to share a couple of resources, you may want to screenshot this. This is the UCLA Mindful app. It's free on the App Store, and it has many basic meditations and recordings that you can utilize as well. And in terms of when you're starting to develop your different mindfulness and relaxation practice. The Calm app is one as well that people find helpful. And then this is a QR code for an Arabic version of a basic breathing technique that we're using in our Mothers and Babies project here at Sidra. Where what we're using is to teach pregnant women about slow breathing and as a calming and a relaxation strategy. So if you want to take a photo of it, if you want an Arabic meditation as well, it'll pop up as a QR code. There'll be a recording. So I'll give everyone a second to take a picture of this if they'd like. Okay. Excellent. Another tool or tip I like to use a lot with myself and with my patients who have a lot of worrying and anxious thoughts is a tool or a strategy called worry time. Okay, we all have anxious thoughts. That's normal. Okay, some have more than others, and some might find themselves feeling debilitated and very kind of run down by their anxious thoughts. The thing is, though, when we tell people don't worry, don't think about your anxious thoughts, it's not only unrealistic, it's not helpful. Because the more we push away our anxiety, the more we push away our anxious thoughts, the more likely it's going to come back. And oftentimes it comes back worse than when we originally had that anxious thought. Because what we know from anxiety is that when we push things away, the more they're going to come back. And so it's better to actually face those worries, face those anxious thoughts, okay? And especially if we push them away all day, what happens is then we try to go to sleep, and I hear this from my patients all the time, the thoughts come back, and they come back with a vengeance, and it becomes like a recording in your head that you can't turn off, and then it disrupts your sleep. So worry time is a good and a useful tip. So how does it work? Worry time involves setting a time in the day, preferably a time when you tend to be more anxious, but not at night. So for some people, that's in the morning when they wake up, they might feel very overwhelmed by the day. So that's when their worrying thoughts come back. For some, it may be when the kids are done with school and, and worrying about like meals and worrying about how to keep them entertained. So set a time in the day when you're going to do this practice, okay? Take a notebook or a journal, okay, and choose a limited time when you're going to do this worry time practice and set a timer. For example, 20 minutes is a good amount of time. Once that time is up, you stop, and you're not allowed to go beyond that time, okay? During that worry time that you've allotted and set a timer for, you write down all your worries, what's on your mind, what are the things that are bothering you right now, what are the things that you're anxious about. And then you look at those thoughts, okay? and you divide what you can control and what you can't control. Okay, you leave those that you can't. Okay, and then those that you can control, you think about ways to address those thoughts, those ways to problem solve. And if you feel overwhelmed by those, even though you know they may be in control or you don't, but you don't know where to start and you don't feel motivated to start, ask someone for help, whether that be a friend, your spouse, your therapist, asking for help at that time, okay? And then problem solving, okay? So with worrying time, you're not allowed to worry or think about your thoughts until that time you've scheduled it. So for example, if your worry time is at middle of the morning, 10 a.m., that's when worry time happens, okay? So again, with worry time, we wouldn't say, don't worry. You know, we hear this all the time, right? You know, there's the song, don't worry, be happy, right? We tell people, don't be anxious, don't worry, don't worry, don't worry. No, it's about worrying is normal, but taking the worry and putting it back in your hands. So it's in your control, okay? So taking control back and putting that control in your hands. That's what worry time does, okay? So I hope you'll try this strategy at home. Another tool I wanted to talk about is related to thoughts and thinking and how important those are. Thoughts are all the things we tell ourselves, okay? It's our conversation in our mind, okay? It can be conscious, we can be aware of it, or it can be unconscious, okay? And we have several thoughts at any given moment. We don't even realize we're having them. And sometimes they actually conflict with each other, okay? Some thoughts are neutral, some thoughts are helpful, and some thoughts can be harmful, okay? And thinking about mindfulness, what we talked about earlier, okay, if we become aware of the many types of thoughts we have, okay, we can learn how to use them to achieve a healthier mood and to put us in a better mood. Because what we know is that thoughts and mood are actually closely connected, okay? But we can't control our thoughts or change our thoughts without being aware of those thoughts first, okay? So I want you to, here's a list of 2 thoughts that a mom could have, or 2 thoughts a pregnant woman can have, okay? And I want you to type in the chat some helpful thoughts and some harmful thoughts, okay? So a helpful thought that a pregnant woman could have is, I'm going to be a good mother. A harmful thought is, I'm not going to be a good mother, okay? A harmful thought could be, COVID will last forever. Pandemic is not going to get any better. We're going to be in this for the long run. A helpful thought could be, this is a difficult time, but COVID will pass. A harmful thought could be, you know, virtual learning is terrible. I can't do this. This is too hard. A helpful thought could be, this is a difficult time. Yes, it is hard, but there are things about COVID that have been helpful, like it's giving me more time to be at home, to be with my children, because things are closed. So you see how being aware of these thoughts that we're having and thinking about some helpful thoughts to counteract some harmful thoughts can affect your mood and can affect your outlook on things, okay? And that may be easier said than done. So I wanted to actually talk a little bit about some ways to challenge harmful thoughts, some specific ways, some specific questions and exercises you can do with yourself. And again, you might find this helpful to screenshot. So there's some various harmful thought patterns that we know from the research and from working clinically. One is this all or nothing thinking, okay? So that's thinking in extremes. Thinking that everything is either good, or it's either all good, or it's all bad. Thinking that things are the best, it's the best day or the worst day, okay? Thinking you're either perfect or thinking you're a failure. That's an all and nothing way of thinking, okay? So one all or nothing kind of thought related to being a mother could be, I'm a failure as a mother, and okay? So there's no, I had a hard day, but that day could, you know, tomorrow will be a different day. So a way to talk back to that harmful thought pattern, that all or nothing thinking, is thinking about what's in the middle. Is there a shade of gray? Okay, is there a however statement in there, in that thought? Another harmful thought pattern is overgeneralization. That's taking one negative characteristic or event and seeing it as a never-ending pattern. For example, someone betrayed you, so you don't trust it. You say, I don't trust anyone, okay? Because that friend betrayed me, I don't trust anyone. I'm never gonna have friends. Okay, that's an overgeneralization, okay? I couldn't do this one thing, so I can't do anything. So related to being a mother, it could be something like, I couldn't settle the baby, I can't do anything right for my baby, okay? A way to talk back to that harmful thought is asking yourself, am I assuming that this situation is the same and that it's related to everything, every aspect of being a mother? Is this just this one instance, this one situation, or this one person? Can I remember other instances or situations where things were different, or with people that things were different? That's a way to counteract that overgeneralization habit. Another harmful thought pattern is blaming oneself. So thinking that when negative things happen, that they're always our fault. Okay, for example, it's my fault. I can't get a job. There's something wrong with me. Okay, a way to challenge or talk back to that, the harmful thought, okay, is asking yourself, am I really to blame for everything that turns out badly? Do only bad things happen to me? They don't happen to anyone else? Okay. So think of these ways of talking back to your harmful thoughts as a way that maybe a supportive friend might talk to you. So trying to be that supportive friend to yourself. Remember, another way is remember that the good has happened to me and all that I have achieved when you start blaming yourself and thinking only bad things will happen. Okay. Another harmful thought pattern is negative fortune telling, thinking that you can see how things will be in the future and that you're sure that it's going to turn out bad. It's not going to go well. Okay. For example, you might have this thought, I'll always feel bad. I'll never have my life again after you have a baby. Things will never be normal. A way to counteract that harmful thought pattern is asking yourself, can I really predict the future? Why not see how things go rather than just imagine the worst? For example, you have a big presentation, you have a big interview, and just imagining it's going to go bad. That's negative fortune telling. Okay, so telling yourself also that things could change, things could get better. Okay, I'm never going to see my family because there will always be restrictions or there will always be quarantine. So changing the way you think about things and not seeing things always as a negative that will happen in the future. Some more ways to challenge harmful thoughts. These are some actual methods that you can use, some techniques that you can use, including thought interruption, which is to tell your mind to stop thinking that harmful thought. It's literally like holding a big stop sign for your mind and visualizing that. To do this, you first have to notice that you're thinking that harmful thought. So that mindfulness plays a role as well here. And remember, we've been talking about mindfulness. So let's practice. Let's go through an example. You have this thought, I'm a bad mother. Okay. You catch yourself thinking that. Okay. Instead of getting caught up in all the reasons why you're a bad mother, I'm a bad mother because of this, I'm a bad mother because of that and that and that. Just think, there's that harmful thought again. I've had that thought before, okay? I know it's a harmful thought. I'm gonna stop thinking that now. And if I can't stop it, okay? So I'll just let it go right by, let it pass, okay? So don't put so much attention to that thought. Don't keep feeding into that thought and finding ways to support that thought. So I'm finding evidence, okay? Say, this is a thought. It happens sometimes. I feel bad sometimes. Let it come and let it go, okay? And that's what thought interruption is, okay? So sometimes also it can be helpful to think of a more helpful thought. So maybe even to counteract that negative thought. So things that for this, I'm a bad mother, instead saying to yourself, I'm not a bad mother. I'm just really tired right now because the baby was up all night and I need to try to get some rest today so that I have more energy for my baby. You see how that's helpful? That's telling yourself, I'm just having a bad day, but I'm going to do something about it. Okay. Another technique that you can use is time projection. And when we talk about time projection, it means imagining a time in the future when things will be better. So let's practice. For example, you may have this thought, I will never sleep again, the baby will never sleep, and I will be tired forever. And these may seem extreme, but trust me, I've thought these things. I've seen my patients think these things as well. Okay, so sometimes when things are going badly, we think that things will stay bad forever. And this strategy reminds you to have hope for the future when you're feeling really down. And sometimes imagining the things we want for the future can give us hope and motivate us. And so imagining that things are always changing, so it's unlikely that how things are right now is how things will be in the future and forever. Okay, so for example, for that I will never sleep again thought, a time projection strategy could be, you know what, baby will eventually grow older and will learn how to sleep through the night. Or baby is still learning what day and night are, and it will be better in a few months. And imagining that, seeing that happening. Okay, so that's time projection. So those are some tools for challenging harmful thoughts. And again, really understanding that there's a strong correlation between our thoughts, our feelings, and our mood. So if we can control our thoughts, it can help our feelings and our mood as well. And it's going to take practice, because some of us are used to having more negative or harmful thoughts. So it's a kind of a muscle that we have to build in order for it to have an impact on us, just like mindfulness takes practice. Okay. And then I wanted just to share some additional resources that I think you might find helpful for women and during the perinatal period, for mothers and mothers-to-be. And I want you to type in the chat or any resources that you know of that I might not have put it here, including local ones. Okay. There's Postpartum Support International. It's an international organization that has a lot of online support groups. They're very active on Instagram as well. So if you want to note that website, they do a lot of online events, and they have online support groups for different mothers and different types of mothers. Okay. There's the Maternal Mental Health Leadership Alliance. It's based in the US, but they hold a lot of they have a lot of resources on their webpage, and they hold a lot of free seminars, and there's a lot of self-help tools on both their Instagram and on their website. And then there's the Maternal Mental Health Alliance, which is the Maternal Mental Health Alliance organization based in the UK, also has a lot of helpful tips and tools and resources. And then I wanted to share with you the Mothers and Babies Program website, which has a whole self-help curriculum and in different languages. And this is the intervention that we are adapting and conducting a randomized control trial here at Sidra. So you might want to jot down that website as well. And in terms of local resources based in Qatar, support groups or where you can connect with other moms that I found. And again, type in the chat if you know some other groups, and these groups are pretty active. They're on Facebook. There's the Positive Birth Group Doha, which if you're gonna just search for it on Facebook, there's a lot of there's a large community of moms and moms-to-be, and it's in English. And then in Arabic on Instagram, I found these two resources to be very helpful. It's one is the goes by the handle young _mothers _QA. And the other goes by the handle mother_in_making. Both of them are resources in Arabic, a lot of tips, a good way. And I think Young Mothers also has a way to connect mothers who are here locally based in Qatar to each other. Okay, so if you want to take a screenshot of that. So those are some various tips and resources. And before I hand the mic over to Dr. Felice again to talk about this year's theme for World Maternal Mental Health Day, okay, I wanted to say a couple of final notes. I think it's important for us as mothers and mothers-to-be is to get resources wherever we can, but to also know when to seek and when to ask for professional help. So when you feel like you are struggling, when you feel like there's more than you can handle on your own, when you're not functioning, seeking professional help is the way to go, okay? And whether that be medication or therapy or combination of the two, talking to your obstetrician, your midwife, talking to your general practitioner. And also at Sidra Medicine, we have the Women's Wellbeing Clinic, which is specifically designed to serve mothers to be and mothers in the postpartum period. So seeking professional helps no one to do that. And understanding that mental health is health. There's no reason for us to separate mental health from health in general. There is no health without mental health. Okay, and mental health, of course, impacts your physical health and vice versa. And also understanding that maternal mental illness is one of the leading causes of disability and death for women worldwide. So it's time to reduce the stigma regarding mental illness and treatment for mental illness. I can't tell you how many times I hear from women, from patients, that their family members don't know they have a mental illness. Their family members don't want them to come to treatment. They have to hide that they're coming in. It's time to reduce the stigma about mental illness and maternal mental health in general, and accept and support women who are seeking help, okay? Because mental illness is treatable, okay? And it's important to think about the role that husbands, communities, societies, and policies play to promote maternal mental health, especially thinking about that today on World Maternal Mental Health Day. And with that, I'll end my portion of the talk before I hand over the mic to Dr. Felice, who will talk a little bit about this year's theme for World Maternal Mental Health Day, and then we'll go ahead with questions and answers from the audience.
Thank you so much. That was amazing, and something that we can review, particularly as it's on YouTube now, something that we can go over again and again because there's so much information in there. Can I just remind the audience to fill in the questionnaire that we posted early on about who are you, and also to post any questions on the chat. So very briefly, let's talk about investment. And this is not only about money. We want to invest in our mothers, in our children, our families, our nation, and our world. And it is really important for us to consider the mental health of mothers, because it does have ripple effects on all of the above. So who needs to invest? Mothers. And if you're a mother or a woman who's going to have a baby and you've spent some time listening today, that's investment. Caring for yourself, doing the kind of self-care strategies that Dr. Sawssan talked about, looking after yourself is an investment in your mental health, your physical health, and in your children and families. Families. Invest in the mental health of mothers who are in your families, whether it's your daughter if you're a grandma, your wife if you're a husband. Invest in mothers, and how can you do that? By being aware of all that they do, supporting them in practical and emotional ways, and being aware of symptoms if they start to show them and encouraging them to get help. Society as a whole, we need to invest in maternal mental health as a society. And part of this is about increasing education, as we've done today, about maternal mental health. Also about reducing stigma, having conversations that see mental health as part of health. And governments and also non-government organisations, health organisations, have a big role to play. And part of that is making laws that will actually protect women, children and families. Maternity leave, domestic violence laws, social supports for families in need. Health departments, please invest money in women's mental health, because that investment is going a long way. In Qatar, we have a number of services, which is amazing, but there is more to be done. Health professionals, you're investing in maternal mental health in many ways, and not only in women individually, but also in training and teaching a new generation of doctors, nurses, and other health professionals. So investment can happen at multiple levels. It can be time, expertise and abilities, and resources, and all of these are needed. So thank you so much for joining us today, and I can't see any questions in the chat. So I'm thinking, Dr. Sawssan, that we might finish. So thank you again, everyone, and remember hashtag maternal mental health matters, and thank you from Sidra Women's Mental Health Service. Bye for now.